7 Warning Signs of Infertility in Women. There aren't any foolproof ways to ascertain if a woman might be infertile. It is not a disorder that gives you very obvious signs and symptoms. Mostly women over the age of 35 after an unsuccessful 1 year of trying to conceive realize that they perhaps are infertile. Usually unable to get pregnant in about 12 months' time of having unprotected intercourse is the greatest indicator that there might be a problem somewhere. This is when, without any further ado, you should reach out to your doctor. But be assured that infertility can be treated. And if you wish to be a mother soon, there are several medical procedures including IVF. But even if you aren't looking to have a baby just yet, you can watch out for these signs of infertility in women. We discuss the 7 major signs which are a definite indicator of infertility in women. 1. You have always had irregular periods. Now, do not make peace with this sort of a situation. If your periods do not follow the stipulated 21 or 35-day cycle, you need to be wary. Because if nothing else, irregular periods indicate that you are not ovulating every month. This is among the sure-shot signs of infertility in women. Though such a condition can be treated provided you raise the alarm earlier on. You need to ovulate regularly to get pregnant. Statistics show that irregular ovulation is the primary cause of female infertility. There are treatments to cure this condition. And if you intend to get pregnant in the future, initiate now. 2. Your periods have suddenly stopped. Now, if you are not a menopausal woman, and also not under any medication to delay or temporarily stop your periods, be very concerned. Your periods in such a situation shouldn't naturally stop. Stop periods mean no ovulation. And if you are not going to ovulate, you shall not get pregnant. Ovulation is crucial to pregnancy. And halted periods is among the clear signs of infertility in women. Immediately consult your gynecologist and start on the requisite medication. Of course, there is treatment for stop periods. Signs of infertility in women. 3. Your periods are very heavy. The flow of the vaginal blood should be moderate. Anything above that, which normally keeps you in bed, is a cause of concern. Heavy periods are an indicator of no ovulation. This is because the release of the egg from the ovaries triggers the production of the hormone progesterone. This hormone is responsible for giving you healthy periods. Now, when you don't ovulate, the lack of this progesterone leads to extremely heavy menstrual blood flow. This is a definite hindrance in your pregnancy plans. Notice this trend in your periods for a few months. If they are consistently heavy, you need to see your doctor at once. 4. Pain during sex. Either your periods are very painful, or you experience pain every time you have an intercourse. These can be veritable signs of infertility in women. Have you noticed blood in your urine, or you have terrible rectal pain? Oh, these are conditions of endometriosis. Stats show that about 7 billion women in the USA suffer from this condition. And of them, about 40% turn out to be infertile, because you have an extremely difficult time trying to get pregnant. Endometriosis can be treated. Hence, observe your body and don't feel shy to talk to your doctor. 5. Growth of unwanted, dark hair on your face. Have you noticed a sprouting of thick, coarse body hair on odd parts of your body? This could be an indicator of PCOS or polycystic ovarian syndrome. PCOS is generally a condition in which a woman's sex hormones, progesterone and estrogen, are way off. This often leads to the formation of cysts, though benign, in the ovaries. PCOS have a bearing on a horde of things such as the functioning of your heart, your menses, and most importantly, your fertility. There are several factors responsible for PCOS, such as the overproduction of the male sex hormone, androgen, genetic conditions, among others. but culture among the important signs of infertility in women. So without losing time, get yourself checked. Six. You are losing excessive hair on a daily basis. Well, now hair loss is not a definite indicator of infertility in women. There are several environmental and internal factors that could be attributed to hair loss, infertility being one of them. An unchecked thyroid could be a reason for hair thinning or hair loss, as are anemia, autoimmune diseases and psoriasis. Again, an important cause of sudden shedding of hair or abnormal hair thinning is undiagnosed PCOS. Observe your body closely to check if your hair loss issue is grave and sudden. Fix an appointment with your gynecologist, for it is going to affect your chances of getting pregnant in the future. 7. Poor sex drive. Either you are having extremely painful sex or you have genuinely lost interest in sex. Both are conditions that need some mulling over. Stress, depression can often be the cause of a plummeted sex drive. Not to mention, there are a host of medical conditions contributing to the same, including infertility. If you are not going to have natural, healthy sex, you are not going to conceive your baby. So, don't leave it off as just another phase. A drastic drop in sex drive can never be normal. Be informed, you need to consult your doctor about this. There are superb treatments to get it back up and running. We sincerely hope you are not suffering from any of these conditions, and even if you are, there is no need to panic. All these conditions, while they are signs of infertility in women, can well be treated if you attend to them soon enough.